Hey mamas! So today we're talking about how breastfeeding is a natural contraception, especially in the beginning of your breastfeeding journey. It's not 100% like super reliable, but it really does work for a lot of women. So I'm going to talk a little bit about how it works and how amazing it is. It's nature's natural way of kind of like signaling to your body, okay, we have a baby right now that we have to take care of, we have to breastfeed, and your body has to get ready for that. So right now we're just going to postpone and delay any type of conception of a new baby. So it's pretty awesome. The technical term is called menorrhea, and that's called menstrual delay. So basically you're not going to be menstruating during this time. For some women, it can go as much as a year. For some women, it can just be a few weeks. So it really depends on woman to woman and what your lifestyle is, what's going on in your life during that time as well. Because obviously it does do with hormones as well. But it's pretty amazing how this happens. And in fact, the actual statistic is 40 to 50% of women will get their period during those first 6 months. So that's pretty amazing. But like I mentioned, it's not foolproof. There is women, and I know a lot of women personally, that get it within the first few weeks of breastfeeding, and that's why we see a lot of women that end up having those what do they call it, swins or something like that, when the babies are born within a year, less than a year apart, and that happens very often. So this method is not completely foolproof. Don't rely on it 100%, but if you are following, if you do have like a tracking app, you can be following when you would be getting your period normally, and kind of you can just make sure that you're aware of symptoms and things like that happen before you are ovulated and menstruating and things like that, so that you can keep track of knowing what's going on with your body. But I wanted to explain a little bit of the science why that happens. So it has to actually happen in your body for your body to produce milk is there has to be prolactin, right? That's what actually causes our bodies to signal that we need to make more milk, and prolactin is going to suppress ovulation. So that's really why it happens. So that brings me to my next point about the foolproof that I talked about before. So what you want to make sure is that if you are breastfeeding 100%, okay, so you have to be breastfeeding pretty much all the time. If you are doing like formula feeding and breastfeeding, then this method of contraception is not going to work, because your body's not going to have the same levels of prolactin as a woman that is lactating all the time, that is breastfeeding all the time. What also may affect it is if you're pumping as well, because remember that when you latch your baby on, that whole connection of your baby's saliva with your breast, your body knows that that baby is latching, and that's how it's able to tweak the milk to the baby's needs. Like if the baby has a cold or a fever or anything that's going on with your baby, that milk will change and adapt to the baby's needs. So that's something else that you have to kind of look out for. So this method is really good if you are breastfeeding 100%. And I'll give you my own testimony, which for me, in fact, it was really hard for me I wanted to have my babies kind of like back to back. So it was really hard for me to get pregnant again after I had my first baby, because at 1 year old, I was still not getting my period. So I had to kind of cut down on that breastfeeding for my ovulation cycle to start again. And as soon as I did kind of do that switch, my body kind of knew like, okay, maybe this baby is not breastfeeding anymore and this baby is good to go, so we can start a new batch kind of thing. So that's pretty awesome. So remember, this method is not 100% foolproof. Make sure that you're breastfeeding 100% and that you're following your symptoms and your hormonal changes. And also be sure to check out in the comments below. We have a really cool discount for our Mommyzlove store, which I'm sure you're going to love checking out if you're a breastfeeding mama. Bye.